Ladies and gentlemen, it's an enormous pleasure to welcome you to this fourth tutorial lecture being given by my very dear friend and colleague, Professor Mary Dyson. I've known Mary personally for, let's see, nearly 16 years. 16 years.
Come on, she's not that old.
No, but I knew her when she was a student. But I knew of her much longer before that, because the name of Mary Dyson is synonymous with tissue repair, cellular examination, and laser and light therapy. Wound healing is nothing until it's been explained by Dr. Dyson, and then you understand it completely. So I'm going to leave you in her very capable hands, and she's going to talk to us about the essentials of wound healing and the role of phototherapy in its acceleration when delayed.
Thank
Mary,
you, Glenn.
please.
How can I follow that? Anything I say is bound to be an anticlimax. I'll do my best. Now, the topics I'm going to go over with you today are wound healing, a definition and a description of its stages, and then how it's controlled by means of this lovely system, a combination of three systems: the neuroendocrine immune system, or some people call it the neuroimmune endocrine system. And I want you to think about how photons reach the cells of this system and what they do when they get there. What they can do is help the acceleration of delayed wound healing, and they can affect chronic wounds. You know, if you, clinicians, go out there, you could stop the problem of chronic wounds altogether. Don't worry, I'm not going to do you out of a job. There'll be more people coming along with them, but you can deal with them, and you can deal with them now. And I'm also going to end by talking to you about the future. What I want you, clinicians, biologists, engineers, physicists, to do, so that when I get even older and get chronic wounds, I haven't got any yet, but you never know, I want you to be able to fix me straight away. Okay? Is it a deal? Yes. Is it a deal?
Yes.
Thank you. Wound healing is the closure of an injured surface such as skin and the replacement of damaged tissue. The epidermis regenerates, the dermis repairs. Repair isn't as good as regeneration. You can see the epidermis here, you can see the dermis there, and there is a nice big wound. And we're going to look at how that heals and how light coming in can affect healing. Regeneration is perfection, the perfect restoration of form and function after injury, and the epidermis has got it sorted. It can do it. Repair is imperfect replacement of injured tissue by scar tissue. It usually occurs reasonably rapidly. It's good enough for you to get on with your life, so we put up with it, unless you're a cosmetic surgeon or a plastic surgeon, and then you want to improve the quality. And I take my hat off to you, or I would if I was wearing one. Now, most wounds can heal pretty well. If you take a fit young man or a fit young woman and you make little holes in them, they can generally heal. I don't think he's going to cope with all those, especially the ones that are cranial. But things like that, no worries, you can deal with it. But there are problems associated with repair, and these problems are delayed healing, sometimes leading to chronic wounds. You can meet and probably have met people who've had lesions, chronic wounds for 20, 30 years. How dare we let people tolerate that? It's our job to improve their quality of life. And remember that chronic wounds can kill. It was a chronic wound that killed Superman, Christopher Reeves rather. So someone like him ought to have had pretty good care, but I bet he didn't have a laser. Why not? Because we don't talk loudly enough, but I'm going to try and change that. The other problem is sometimes you get too much granulation tissue and you get hypertrophic or chronic or keloid scars. Now, if you start off with a nice picket fence, the skin, and you make a hole in it, we'd love regeneration, perfection, And we get that in the epidermis, but we make do with scarring. It's good enough. Unfortunately, sometimes we get a hole that stays and stays, a chronic wound, or we get too much granulation tissue. A hypertrophic wound, if it stays the size in terms of area of the original wound, but sometimes it becomes a benign lesion that extends and extends, and you get problems that can cause psychological problems because of the deformities that they cause. Can phototherapy, also known as LLLT, which some people call low-level laser therapy, but it's the light what matters, the photons, I think. And therefore, let's call it low-level light therapy. Just humour me. I'm a little old lady, so let me have my way for a few minutes. Can it heal it? Yes, it can. Notice that the S is in red. If you see anything up there in red, it's a take-home message, something to think about, remember, and tell people about. The stages in wound healing are blood clotting, hemostasis, followed by acute inflammation. That's nature's first aid. And that sets the scene for proliferation to occur, for contractile, very vascular granulation tissue to form. This is a rich red carpet that the cells will walk over. It's not like this thing. If I was a keratinocyte, I wouldn't walk over this carpet, but if it was red, I would. You need red, you need blood, you need vascularity for repair. Quite a nice carpet, but not for wound healing. Now, remodeling, that is when the granulation tissue is gradually transformed into scar tissue. People talk about healing as being a wound's healed when it's re-epithelialized. No, it ain't. You have to have good dermal substitute, a good scar, to get a wound that won't break open. Now, the stages in wound healing are shown here. Inflammation, very important. Lots of people hate inflammation. Nasty. Get rid of it. Well, I want to get rid of it by shortening it in time, but not to get rid of it completely, because during it, cells like macrophages and other inflammatory cells, and also non-inflammatory cells later, produce chemicals, soluble protein mediators that push the body from inflammation into proliferation and into healing. And you get a change in cellularity as we go from inflammation to proliferation. Here, the macrophage is king or queen. Over here, it's the fibroblast and the endothelial cell. Some of the fibroblasts become contractile. They switch from one job to another, and they become myofibroblasts that pull the edges of the wound together. And then you go into remodeling, and you get scar tissue, which is less vascular and less cellular. But notice the epidermis has dug away between the scab and the living tissue and has regenerated beautifully. We can improve it, but now let's think about the stages and what they involve. Acute inflammation is initiated by the interaction, it's all about interaction, this talk, of peripheral neural C fibers and inflammatory cells. The inflammatory cells produce soluble protein mediators like cytokines and other things after injury. Both are affected by phototherapy, so treatment should start as soon as possible after injury. That's what you need to do. Every soldier should have a laser in his knapsack and have been taught how to use it. And I don't mean one to shine in the eyes of the enemy, though that could be useful, but one to help heal himself as soon as possible. I carry a laser with me, but I put it in my checked luggage, and then I can use it if I need to when I uncheck it. And you know, people bump into you on planes, don't they? Well, they do me. I'm not quite sure why, but they do. So when I get to the hotel, out comes my trusty laser. The reason that inflammation has got a bad name is because of these characteristics. You get too much heat, you get too much redness, you get swelling, now that is nasty, you get pain, and this produces functional impairment, shown diagrammatically here. Heat, redness, a bit of embarrassment there, I think, but it has got a fig leaf. Swelling, that's the bad guy, because the edema pushes on the nerves and the vessels and makes the situation inside the wound worse. But you feel pain. That is useful because you do something about it. You don't always feel pain, though, and that can be a problem. And then there's also loss of function. And you go to see your doctor and say, look, can't you get rid of this? I want to be fit again, preferably tomorrow, or even better, before I did myself a mischief. And maybe that's something we should do in the future. Treat athletes before they go into the Olympics, so that they're in a state in which the cells are already geared up to repair them if anything goes wrong. Now, acute inflammation is an essential part of wound healing. Notice it's in red. Remember it. Why is it essential? Because during it, soluble protein mediators are secreted. They're secreted during acute inflammation, and they allow healing to progress from inflammation to proliferation. That's what you want, as quickly as possible. We classify these protein mediators into chemokines and cytokines and growth factors. When I started a long time ago, I just knew about cytokines and growth factors. Then, I think it was 1998, along came the chemokines. They were recognized. Chemokines, like fractalkine, they're chemotactic. They attract inflammatory cells to the wound site. So when they're there, they'll release their goodies and stimulate repair. They're secreted by inflammatory cells like the natural killer cells, the NK cells. These cells go around finding things they don't like the look at, and they kill them. If they don't recognize them, they kill them. These are the 007 cells of the body. They're the James Bonds. They go out there. They're licensed to kill, and they do it. But they also make useful things like chemotactic soluble protein mediators. Then we'll go on to the second group, the cytokines, like IL-4, IL-8, and so on. These regulate inflammation by affecting proliferation and differentiation of inflammatory cells. Some are pro-inflammatory, others are anti-inflammatory. We need pro-inflammatory ones shortly after injury, then we need to get on to the anti-inflammatory ones. And in a healthy human being, that's what happens. But lots of people aren't healthy, and they're the ones we need to help. They also regulate the non-inflammatory cells, helping them make matrix and helping them make proteases that remove matrix from the wrong place and allow cells to wriggle through it to heal the tissues. The final group are the growth factors. They promote, red again notice, the proliferative phase of wound healing. They promote angiogenesis and wound contraction and matrix synthesis, and they're great, and we want to encourage them. They're part of the cocktail we need, and we need to get onto that cocktail as soon as possible. Where do they come from? From inflammatory and non-inflammatory cells. Those are the inflammatory ones, and those are examples of non-inflammatory cells. And if you look at a bit of dermis, you will find these cells scattered around all over it. There's a macrophage there. The little lumps and bumps on it contain soluble protein mediators waiting to get out. If that cell absorbs light in its mitochondria, you'll get changes that will eventually, or quite rapidly, produce permeability changes at the membrane level, and the soluble protein mediators come out. And what they do then is affect the cells that cause repair, cells like the endothelial cells and the fibroblasts. Now, these are the actions of these things during wound healing. Some initiate inflammation. Others recruit cells to the wound bed. Others remove debris and infection. And others, the really important ones, the growth factors, these promote proliferation. These are the really important ones. And since these mediators are produced sequentially, we want to get onto this phase as soon as possible. Can photons help? Yes. And the reason that they can help is that there is good evidence that they stimulate the release of soluble protein mediators, and that means that you can get faster resolution of acute inflammation and progressive healing if the healing is delayed. It's easy. And any laser, almost any source of photons, can get to the more peripheral, the more superficial of the cells, and some are very superficial. So remember, acute inflammation is good. You get progression from secreting pro-inflammatory to anti-inflammatory soluble protein mediators, and that promotes healing. It's chronic inflammation that's bad, And that's when we need anti-inflammatories.